Hi, welcome back to Mama's Got a Brand New Bag. Today we're going to tackle one of the most common sources of confusion in digestive health, IBD versus IBS. These two conditions sound incredibly similar. They share some of the same symptoms, and because the names are only one letter apart, they're often used interchangeably. However, medically speaking, they are very different conditions. Understanding the difference matters because the causes, treatments, and long term implications are completely different. So today we're going to talk about what IBS is, what IBD is, why they get confused, and how to tell them apart. Let's start with why this confusion happens in the first place. Both IBS and IBD can cause symptoms like abdominal pain, diarrhea, bloating, changes in bowel habits, and urgency to use the bathroom. So, from a patient perspective, the experiences can feel very similar, but the underlying cause is completely different. One involves inflammation and structural disease. The other involves how the gut is functioning. This confusion is what can make it challenging to differentiate between the two when you're a patient experiencing the symptoms. IBS stands for Irritable Bowel Syndrome. It's what we call a functional GI disorder or a disorder of the gut brain interaction. That means that the digestive tract looks normal, but it doesn't function normally. The intestines may be more sensitive, the muscles may contract differently, the gut brain connection may be a little altered. So the symptoms are very real, but if you were to look at the intestine under an endoscopy, the tissue usually appears normal. IBS symptoms often include abdominal pain that improves after a bowel movement, constipation, diarrhea, alternating constipation and diarrhea, bloating, and increased gassiness. Many people with IBS also notice that symptoms worsen during times of stress, when they eat certain foods, or during hormonal changes. It can take time to identify triggers because without knowing the triggers, it can make it hard to decide what you need to change so that you feel better. IBS is extremely common. In fact, it affects somewhere between 10 to 15% of people, and probably on the higher end because no one loves talking about poop. The important thing to remember is that while it's uncomfortable and frustrating, IBS does not cause permanent damage to the intestines. So while it is hurtful, it is not harmful. Inflammatory bowel disease, or IBD, on the other hand, is an autoimmune driven inflammatory condition where the immune system attacks the GI tract. Most commonly, Crohn's disease or ulcerative colitis. Unlike IBS, IBD actually causes inflammation and injury to the intestinal lining. When doctors perform imaging or colonoscopies in someone with an IBD, they see things like ulcers, swelling, bleeding, scar tissues, or narrowing of the intestines. Over time, IBD can cause structural complications such as strictures, fistulas, or abscesses. Because of this inflammation, IBD often requires medical treatment to control the immune system, and that can include things like biologics, immunosuppressants, or steroids, sometimes even surgery. One reason these conditions get confused is that the symptoms can look so similar. Both IBS and IBD can cause abdominal pain, diarrhea, urgency, and bloating. But there are some symptoms that raise the concern for IBD. These include blood in the stool, unexplained weight loss, fever, anemia, growth delay in kids, or waking up in the nighttime to have bowel movements. These are what we refer to as red flag symptoms. When these are present, we usually take the steps of investigation just a little bit further. What can be challenging is that both IBD and IBS patients can have their own unique constellation of symptoms, which can wax and wane over time, which adds another layer of complication to diagnoses. Because IBS does not cause inflammation, diagnostic testing often can help distinguish between the two. Doctors may use things like blood tests looking for signs of inflammation or anemia, stool tests like fecal calprotectin, which measures inflammatory markers within the intestines. Elevated levels suggest IBD or other inflammatory conditions. Imaging like MRI or CT scans can show bowel inflammation or complications. And endoscopy allows doctors to directly visualize the mucosal lining of the GI tract and obtain biopsies. IBD will typically show visible inflammation or microscopic changes, and IBS will not. Okay, so now we talked about the difference between the two, but is it possible to have both? Interestingly, yes. Many patients with IBD also experience symptoms of IBS, even when their inflammation is controlled. The gut can remain hypersensitive even when inflammation is quiet. So, treatment may involve addressing inflammation and dysfunction of the gut brain interaction at the same time. Both IBS and IBD are strongly connected to the gut brain axis. The digestive system contains millions of nerve cells and communicates constantly with the brain. Stress and emotional health can significantly affect digestive symptoms. This is one of the many reasons that GI programs, including the one I work with, now include psychologists who specialize in disorders of the gut brain interaction. Treating digestive disease often requires a whole person approach. Understanding the difference between IBD and IBS helps patients avoid two common problems. The first is dismissal. People with IBS sometimes feel that their symptoms are minimized because the testing is normal. But IBS symptoms are real and can significantly affect quality of life. The second is delayed diagnosis. As we've discussed, there are overlapping symptoms between the two. Sometimes people with early inflammatory bowel disease are initially told that they have IBS. They may require repeated testing to establish trending over time. Recognizing red flag symptoms helps ensure that patients receive appropriate evaluation. Digestive symptoms can be frustrating, confusing, and sometimes very scary. Understanding the difference between functional conditions like IBS and inflammatory diseases like IBD helps patients and providers choose the right path forward. Future episodes of Mama's Got a Brand New Bag will continue exploring life with chronic illness, ostomy care, and the shared space between patients and providers. If you have burning questions, please send them my way and I will do my best to answer them. However you found this podcast and whatever convinced you to stay, I'm really glad you're here. Bye.